This is one in a series of our public service announcements. And today we're going to talk about, is it okay to feel pain with exercise or after exercise? It's a big topic.
It's a big topic.
What
And
do
you know
think?
what? I think pain's there for a reason.
Mhm.
It tells us something. So can you feel pain during exercises? Definitely.
Yeah.
Actually, one of the parameters for a really good stretch is that on a scale from 0 to 10, you should feel a 7. If you're stretching, and you don't feel anything, then you're not stretching.
Then it's not going to be effective.
Right. So for certain things, you do need to feel pain. Sometimes when a therapist goes in and does deep tissue, that can be painful. So yes, you can feel pain during certain exercises and treatments. Should you feel it afterwards? Well, I tell my patients, you can feel it in your muscles. You feeling it in your joints, that's what you have to be afraid of.
Right.
Or not afraid of, concerned with.
Yes.
All right. So, your thoughts. I chatted away.
No.
You
I agree
contribute.
with all of that, and I think there's a difference in quality of pain as well. So a lot of people aren't necessarily used to feeling soreness after exercise in their muscles,
Right.
And that is a feeling of people can describe it a little differently, but it could be a heaviness, an achiness, sometimes even cramping or throbbing. But if it's in the muscle and it goes away within about 48 hours. That's probably okay.
Perfect.
And diminishes. And there's something called a delayed onset of muscle soreness that happens after strenuous exercise that can occur the next day or even the day after you did something new and really challenged your muscles. That's okay. Now, the type of pain that you mentioned that's not okay in the joints, and that can be swelling. Sometimes that's an indication that you probably pushed too hard or maybe did something that wasn't appropriate. Or if it's like a stabbing pain or you're not able to move your joint through its full range of motion, those are more warning signs. So I think if it's in the muscle and it's associated with a new stress on the muscle that you challenged yourself in a different way, and it occurs a day or maybe even two after, but then sort of subsides, that's okay to feel that kind of pain.
And actually, you should be proud if you have that kind of pain.
Yeah.
Because athletes live with that. I mean, they live for that.
Yes.
They know, and what both of us, we work out. I know when I'm sore, I did a great workout.
Yeah.
But that's muscle soreness.
Right.
All right. The other one that Dana was talking about, that stabbing sharp, in the joint, you can't move it. You definitely have to tell your therapist the next time you see them.
And on that note too, if you're performing an exercise and you feel pain in the joint, that's something to alert your therapist about as well. Now, if you feel it in the muscle and you're feeling challenged and things are hard and working in the muscle, that's okay. But if you're feeling something sharp and stabbing in the joint, definitely alert your therapist. Knowing if you're in the PT clinic with your therapist, there might be a few times where they acknowledge it and give you modifications and work through some of that. But do let your therapist know if you feel something in the joint.
I agree. All right.
Anything more to add?
No, I think we did it.
All right, that's our PSA.